This is Eric Baker. He's 13 and now isolating at home in Chepstow. One of the 43,000, it's now emerged, who in recent weeks may have been wrongly informed they were COVID-free. His dad, Di Baker, also happens to be a Channel 4 News cameraman.
1, 2, 3, 4, 5, 6, 7, 8. Eric got sick, physically sick in the night, about 1 or 2 times in the night. Next morning he had a fever, temperature, so we kept him off school. First thought, COVID, so we do the lateral flow test.
The do-it-yourself rapid lateral flow test appeared to confirm COVID. But then last weekend, as advised, he came to this Bristol test centre for a confirmatory PCR test. These tests get sent to labs for analysis. It came back negative. The family assumed Eric had a cold, but another lateral flow test at home showed
he's positive.
So they went back to Bristol for another PCR test.
After that one comes back negative, we do another lateral flow, and then that's positive. So he's now had 3 positive lateral flows and 2 negative PCRs. And we look at the advice and we call NHS, the test and trace call us, and they say, well, if he's negative on the PCR, he's fine, he can go back to school. But we kept him off school.
An NHS lab has now confirmed Eric does in fact have COVID. With recent reports of many other similar cases, today the body which replaced Public Health England said around 43,000 people may have been given wrong PCR negative results due to a problem with a laboratory in Wolverhampton.
What we've done, we've looked in great detail at this, and our investigations found that there is a single laboratory. We contract with this laboratory and the fault actually appears to be there. We've now suspended those services completely and the rest of the system is working as normal.
The errors occurred between the 8th of September and the 12th of October. What went wrong precisely is not yet clear, nor what repercussions it may have had. The problem is this spans a significant period of time when people who may have had COVID and were infectious were looking at their negative PCR results and assuming they had the all clear, perhaps then going back to work, perhaps going back to school. And are you feeling okay now?
Yeah, I'm feeling fine, just tired.
You're just tired?
Yeah.
So how long have you got to be off now?
Till Tuesday, I think.
Nearly half the cases involved are in the southwest of England, an estimated 4,000 in Wales. Those affected who might still be infectious are being asked to take another test. The system is back on track, we're told. But when people on Twitter, among others, were noting anomalies in the testing data as far back as a month ago, many are asking, why did it take so long for the authorities to identify these failures?